Hi, my name is Daniel Firth. I am a family medicine resident with the University of Arizona, and I wanted to present a brief presentation about the use of mobile phone-based technology for smoking cessation. As we are all well aware, smoking continues to be a widespread problem. 20.8% of Americans still smoke. There is $167 billion in annual health-related economic loss due to smoking, and it is the leading cause of preventable death in the United States. There are many options available to us for treatment. There are medications such as Zyban or Chantix. There's also nicotine replacement, and then there are many different forms of counseling, such as individualized or group counseling, or even telephone counseling. I wanted to give you just a brief history about how mobile phone-based smoking cessation kind of came into existence. The public health department in New Zealand actually realized that there was a group of tobacco users that they were just not reaching very well. This group was mainly young adults. So they wanted to see if they could reach these people with text messaging based smoking cessation messages. So they started this program back in 2005, and they had some early success with it. And then a few other countries, including the United States, the United Kingdom, as well as Australia, went on to develop their own programs as well. The general idea of how it works is that a smoker will sign up either via a website or by sending a text to a specific phone number to start receiving information about smoking cessation as well as encouragement for smoking cessation. They'll get individualized messages that are kind of customized to their age and then their stated reasons for wanting to quit. And then also most of them do ask the smokers to set a quit date. So I want to just take a brief minute to kind of review the current evidence for the use of these mobile phone-based smoking cessation techniques. So back in 2009, about roughly 5 years after they had this technology had just started, Cochrane did a review and found that it was effective in the short term, meaning for the first 4 weeks of smoking cessation, but then on long-term outcomes at looking at 6-month smoking cessation rates, there was no difference. And then more recently, just in September of 2012, Cochrane did another review of the literature. This time they did a meta-analysis of 5 different fairly large studies, included over 9,000 people. And this time they found that actually the mobile phone-based interventions did show a benefit on long-term outcome. And their endpoint was actually 6-month smoking cessation rates. And what they found was that the intervention group was actually 1.71 times more likely to quit than the control group. So, there was some small differences in the study designs of these 5 different studies, but the typical design was that they recruited people either via advertisement or some other way, and then they split them up into 2 groups. And then the one group would receive a series of customized text messages based on some demographic informations, and then the intervention group would then start receiving a series of text messages that were more or less front-loaded, meaning that they received more text messages when they first were starting to quit and then less as time went on. The control group, on the other hand, typically just would receive a generic text message every couple of weeks that in one study just kind of reiterated how important it was for them to follow up with the study, and then another one just would send them a text message about just general health information. There are some limitations to our patient population. One is the generalizability, that this current review is only based on studies out of Australia, the United Kingdom, and New Zealand, and this is mainly because there really hasn't been any high-quality studies done in the United States, although there is one that is currently undergoing right now. Another limitation is that there was a little bit of heterogeneity in the trials. Only 3 out of 5 showed a positive result, and then 2 out of 5 showed a negative result. So, as you can see, this table here is based on the 6-month smoking cessation rate, and you can see 3 out of 5 do show a positive result, 2 out of 5 show a negative. But then in the discussion of the one trial, it's the authors acknowledged that it was slightly underpowered, so maybe it would have been showed a positive effect if it had been properly powered and they reached their desired sample size. So currently there are 2 options for your patients. The first one is called smoke-free text. This one was developed by the National Cancer Institute in conjunction with the Department of Health and Human Services. They spent a lot of money, approximately $5 million, developing it. It's a free service. It's pretty easy to sign up, and they do offer evidence-based and customized text messages. Second option is called Text to Quit. This is the one that has the study that is currently underway. It was developed by a George Washington professor, Dr. Abrams, and what's interesting about this one is actually run by a private company called Voxiva. It's currently free, but on the website it states that it's only free for 4 months. It's not quite as easy to sign up because you can only do it on the website. There's no option to just simply send a text message, but it is also evidence-based, and this one does, as I mentioned, have a randomized controlled trial underway to evaluate its effect. So, how do you actually sign up for these ones? The smoke-free text is very easy. All you do is just simply text the word quit to I quit from any cell phone, or you can also go online. You can go to this address, or you can just type in smokefree.gov, and it's pretty easy to find the link. The other service, Text to Quit, the only way you can join it is from the website. It's fairly easy to navigate, but there is no option for joining directly from your phone. And then with both of these websites, they will ask you a little bit of demographic information. So here are my references, and thank you for your time.